Weird, isn't it, for a hospital to be so quiet? Usually it's like college on a Saturday night, you know, everyone slammed body to body into the elevator hoping nobody pukes on you. It's eerie, isn't it? Almost louder than the chaos. I hate all the on and off again with the clothes. I would be a very bad stripper, even if my nipples were totally symmetrical.
Miss Powers?
Yeah.
I'm Marla, the ultrasound technician. I'll be performing your test today. If you'll follow me this way.
Sure. Is there someplace I should put my stuff, like my clothes, my phone, or...
Actually, there are lockers in the changing room.
Oh, where I acquired my lavish paper gown.
Yes, and you can leave all of your things in there if you like.
Oh, am I gonna be waiting?
No, I'll be bringing you right in.
Okay, I just asked because I want to know if I should bring my phone with me, or...
I actually don't only take a couple of minutes, so you can bring your things in with you if you like.
No, you know what, it's fine. I'll just, you know, put my stuff in the locker.
Great. Exam room 1. See you in a minute.
Great. So, it's important to remember that this vlog is my story and not a documentary. And hospitals won't just let me, like, run around and play with their equipment. So, from here on out, the production values get a little janky. Try to remember this isn't about that.
You live nearby?
No, do you?
I did when I first started working here. My husband and I moved to the Bronx a couple of months ago.
How long have you worked here?
17 years.
Are you serious? You look 17 years old.
Honey, I'm 43.
You are not.
Hand to God. This is my second baby. Don't tell anyone I'm pregnant. I had my first when I was 40. Is this your first ultrasound?
Yeah.
No. This part is a little cold. Otherwise, it's painless. Easy.
I mean, the test seems easy. I have to tell you, though, getting an appointment to get the test was seriously complicated.
Yeah, they don't do a lot of these tests for young women because they almost always turn out to be nothing, which is good news for you. Usually, even when we find something, it's just a cyst, which is easy to treat.
With a giant needle.
Yeah, but it doesn't hurt, really. They numb it all up and...
You hear that? Nothing. Just a tense look. I knew what it meant. I immediately thought of that Simon and Garfunkel song, The Sound of Silence. Fool, said I, you do not know, silence like a cancer grows. What are you looking at?
a mass.
Mass sounds like not a cyst.
No, I'm sorry. I'm afraid it's not a cyst.
Do you know what it is?
I can't really say. I'm just going to take these images into the doctor. He may want to come and examine you himself. It may be a few minutes because you're not on the schedule, but I'll do my best.
Okay. I know you won't believe this, but until that moment, I really didn't think I had cancer. Even with my family history, even with a lump the size of a ping pong ball in my breast, I was sure I didn't have cancer until that moment that Marla stopped talking. I spent the longest 20 minutes of my life staring at the ceiling of that exam room, cursing God, not because I had cancer, but because I had left my fucking cell phone in the dressing room, and there wasn't a magazine in that entire exam room. So here I was, with an infinite amount of time and only one thing to think about: cancer. When I mentioned that in my dialogue with God, I told him it was cool if I had cancer. I would deal with it, just as long as I didn't die. As long as I lived, I would forgive him for everything. Everything. Even allowing me to leave my cell phone in the dressing room.
Hi, Ms. Powers. I'm Dr. Radio.
From this point on, I have to tell you that things got a little fuzzy. But I remember thinking immediately that Dr. Radio seemed like a nice man. A good person to tell you that you had cancer. So, what are you looking at?
Right now I'm examining the tumor.
Tumor?
Yes, I believe so. I'm taking some measurements, but based on the size of the mass, structures of the borders, I would say it certainly is a tumor.
Okay. Ow.
Oh, sorry. I just want to make sure I'm getting clear images. I'm trying to get a look at your lymph nodes to determine if any of them look off.
What would an off lymph node look like?
Thicker than the others.
And,
This one is a little suspicious.
oh my god.
Oh, it's not radically different. I just want to be certain, so I'm taking some images.
Okay.
Okay, you can close your gun. Is there anyone here for you? Did you come by yourself?
Yeah.
Is there anyone you can call to come up?
No, I mean, my boyfriend would, and my mom just found that she's visiting, but I'd rather just, do this.
Okay, well, based on these images, I'm going to recommend that you come in for a follow-up biopsy and mammogram.
So you're saying you think this is cancerous?
Well, nothing is certain until the lump has been biopsied, but I'm saying there's a very high likelihood that this is a cancer.
Do you know what stage, or is it too early to know that?
Based on its size, it's at least stage 2 if there's no lymph node involvement. And I would say that while I would be very surprised if the mass turned out to be benign, I wouldn't be surprised if the node turned out to be negative for the cancer. I just want to be certain.
Okay. I'm sorry, I'm getting so upset.
No, I'm sorry. This is very difficult to hear. But we don't know anything for certain yet.
Yeah. I mean, I'm not surprised or anything. I mean, my mom has had cancer 3 times. I'm not surprised to have cancer. I'm surprised to have cancer today. You know, it's just been a really hard year. My dad died. Just all of a sudden he had a heart attack and he was just gone. And then my mom had cancer and she's fine. But I'm not surprised that I have cancer. I'm just, surprised that I have cancer today.
Marla.
No, I'm sorry. I'm bringing everyone down. So, what's next? You want me to do a mammogram and a biopsy?
Yes.
And how soon can we do that?
Depends on your schedule.
Can we do it today?
Yes. Sure. I'll fit you in. Just come back after lunch.